My name is Andrew Iraqi, physical therapist at Superior Physical Therapy. And one of the most common questions that I get from people is, what is physical therapy? Your doctor may have sent you to physical therapy or recommended it. You may have had a friend recommend it. But yet, if you haven't had an experience, you might have no clue what physical therapy actually is and does. So I'm going to help shed some light on that. So really, the point of physical therapy is to create an environment inside the body that allows for natural healing. So when our tissues in our body are stressed out, physical stress, friction, compression, strain, tension, those tissues have a tendency to have a limit. And once they reach their limit, they start to break down. And that breakdown process then creates inflammation. Inflammation is our body's way of healing itself. So although helpful, oftentimes the body can overreact with too much inflammation. But our goal as physical therapists is to restore the proper motion in order to reduce the tension in the tissue or the stress in the tissue, whether it's a nerve in the lower back, whether it's a tendon in the knee, whether it's a rotator cuff muscle, whether it's neck issues, neck pain. All our purpose is we know how the body is designed to move, and when we watch you move, we're able to identify areas where you're moving improperly that might be causing tissue stress, and then we are able to give you corrective exercises that will help the movement improve and take away the stress from the tissue, and then the tissue begins to heal. So it is a natural healing process without medications, injections, and surgery. That is essentially what our goal is. Now, sometimes we have patients that come after a surgery. So they've already had the surgery, and now our job is to restore motion and strength in that person. Now, those are really two main categories. One is trying to prevent surgeries, and one is rehabilitating after the surgery. We do both. We use a combination of prescriptive exercise, movements, that might be stretching, balance, and then we combine that with what's called manual therapy. So manual therapy basically means I put my hands on you and I'm trying to facilitate the proper motion. We know that the body is very commonly going to take the path of least resistance, and so with my hands I can help your body take a better path. And then really the most important thing that physical therapy, the third element, is educational instructions on what to do on your own. So we identify by assessing the bad movement, we then teach you how to move better, and we give you education so that you can do that movement on your own at home. So hopefully that helps shed some light on what physical therapy is and can do for you.